Morning, everyone, and welcome to another edition of Messer's Webinar Wednesdays. Just a couple quick reminders, if you will. We'll go through the presentation with our guest today, and we do have an area for you to enter questions, and we'll be happy to take on those at the end of the presentation. As a historical fact, just want to remind all you guys today is the 74th anniversary of D-Day in the wee hours of June the 5th and the morning of June the 6th in 1944. A lot of young men faced the ultimate challenge for us with the invasion of Europe. And if you see a veteran today, especially those that maybe have the World War II insignia with them, make sure you stop by and say thanks to those guys. They're all in their 90s now, the ladies as well that served over in Europe and Asia during one of the world's greatest conflicts. So just keep that in mind as we go through our business today. Messer's got a lot of great stuff going on, guys. Things are really starting to ramp up. We're starting to hear little bits of pieces from the carriers, our partners out there, about what they're looking to do in 2019. So if you've got some questions, maybe trying to figure out what to do as far as putting your marketing plan together for AEP, be sure to call and talk to your marketing director here at Messer. You can reach us at 866-568-9649. And my personal extension is 752, but if you'll speak to Faye there at the reception desk, she'll be happy to get you over to the person you normally speak with. The other thing we've got going on, just as a reminder for you guys, is AHIP will be starting in a couple of weeks. That also means that if you're wanting to sell a little bit with maybe a carrier that you're late to pick up for 2018, you need to get that certification done and contracting done immediately. Normally, certifications for 2018 close sometimes in June, so that they can revamp and get ready for 2019. AHIP will be starting again toward I believe the 18th or 19th of this month, so be prepared for that. We'll have some information for you on our website. And I would like to recommend that you guys start to check our website more frequently for updates as far as certifications and any programs that we may have started. If you haven't looked into the Medicare STAR program, again, make sure you call in, speak to one of the marketing directors about how maybe you can take part in that. Had great success with the agents that signed up for that program last year. Also want to remind you that we've got one of the best lead programs in the industry. You need to take advantage of it, guys. If you haven't, call us again, talk about what needs to take place to be part of that program. And also, for those folks that are in the state of Georgia or in the immediate Atlanta metro area, please take advantage of our good friend and colleague Karen Stiggers there. Does a wonderful job. She's currently started a new program for new agents, and maybe you're an agent that wants a little bit of a refresher course. You can find the sign up for those in our emails that have gone out in the last few weeks, or you can reach out to Karen directly through our receptionist here on our number. Let's see what else we've got here today. 2019 plan information. I know a lot of you are starting to ask questions about that. As I mentioned earlier, we should see a little bit more of that, and our good friend Dave will probably tease us a little bit with what Anthem has in store for us in Georgia today, too. So with that, I'm going to turn over our program here to our good friend Dave Burt from Anthem. We're going to talk a little bit about Med Advantage, Med Subs, what you guys could be doing right now, and what you could hopefully see in the near future for us. So with that, Dave, take it away for us.
Thanks, Jeff. I appreciate it. It's always fun to work with Messer agents. Today, I want to go over some things that you'll need to know for the balance of the year. And again, we'll tease you a little bit. We don't have anything approved yet. We are looking for some significant expansion for 2019, and I'll briefly tell you about those before we're all done, and as we go through this. But before I start, I just wanted to introduce our team in Georgia. Tim Denage is our director of Medicare sales, and he's built a really good team here in Georgia. Sylvia Smith and I are the regional sales managers, and we don't have a specific geographic territory, but we just kind of toss the ball back and forth as needed. So you can contact either one of us, and you might hear from both of us one day or one week, or just one of us. But and then lastly, Kiara Jarman is our agency services manager. She's new to us. She works in-house in our office in Ashford Dunwoody Road, and she is a great resource for anything you might need. So this is our team, and I want to also remind you about our broker services team at 800-633-4368. I'll get into it a little bit later, but they are a huge reason why we have a 5-star rating with our PPO plan. And the email address, Medicare agent support at anthem.com, is also very efficient. I use these phone numbers and emails every day. And usually if I send an email to this agent support in the afternoon, I'm like you, I'm out working with agents all day, and I come back and I'll send them a few emails. I'll have an answer by the next morning, or if I do it the next morning, I'll have it by that afternoon. So it's very efficient, and it's a big part of why we have a 5-star rating is the customer service. So what are we going to cover today? We'll cover the 5-star plan. I've been talking to agents and teaching agents about this all year long. It is a great way to prepare for AEP, actually. We'll get into DSNP and the LIS just briefly. We're not going to make it a DSNP webinar, but we'll go over it briefly and the benefits of our DSNP product. We do have some competitive advantages in that market. Whoops. And then I want to talk about some of the other ancillary benefits that our products have, and Medicare supplements. And then we do have an incentive for agents. I know agents always like to make money. I'm a former agent myself, and always like to have other sources of revenue. So this is what we'll be talking about this morning. Let's start with a 5-star plan. I wanted, before we get into how great our product is, I wanted to just go over what is a 5-star plan. And this is right off the CMS website. 5-star plan, CMS rates insurance carriers by star ratings, and 5 stars is exceptional. 1 star is not so exceptional. But the benefit of a 5-star rating, as you can see in that note, is you can switch plans, or not, an individual can switch plans anytime they want throughout the year, which is a huge advantage. And why that's an advantage to agents? Well, it gives you an opportunity to sell year round, one. It also, if you use this opportunity to market this 5-star plan, it's the only one in Georgia. It will give you momentum going into AEP, because if you're marketing this and prospecting for it, you're going to sell a lot of it, but you're going to have folks that are going to want to wait till AEP to make any choices, and you'll be collecting those leads. So you'll be more ready for AEP than you ever have been if you will put a business plan together, put a sales plan together to market this PPO. And the main prospects, honestly, we're selling a lot of it just because we can. A lot of where our prospects are coming from, our new business on the PPO is coming from our Medicare supplement customers. Those individuals who might be on Plan F and have been for many years, and the premium has just gotten to where it's a little higher than they want it to be. So this is a good opportunity. Again, how do we? I wanted to go over some bullets on how we earn a 5-star rating. CMS looks at a couple different things. How do you keep your members healthy? It's all about access to preventative services, access to examinations, and access is about network. How do you help your individual clients manage chronic illnesses? Care and coordination, how frequently a member can receive these services. Again, it's talking about access, network. And then it looks at the entire member experience, not only the care, but the service it gets from the clients. One of the leading indicators for a plan that's performing well is how many individuals are enrolling in your plans. If you have people enrolling in your plan in droves, well, that's a pretty good indicator that it's performing well. And the reverse is also true. If you have people coming off your plan in droves, that's a pretty good indicator it's not performing as it probably should. And customer service, again, that's where our broker line and our customer service lines come in handy, or have helped us get this 5-star rating. They're very good, very efficient, and again, I use them every day. I would encourage you to do that as well. This is the area that I had a map, but it wasn't a very good map. It had all of our product maps were kind of into one map. So I just listed out the counties, and just to go in a nutshell, we've expanded from 19 counties to 41 counties in 2018 for PPO and for DSNP. And as you look at this list and find your particular service area, I would mention a couple of places. Macon-Bibb County is one of our expansion areas, and every county that surrounds it. So if you're middle Georgia, you've got a huge market to work down there for PPO and D-SNP. Coastal Georgia, Chatham and Effingham counties, it has been a very good market for us. And of course, Metro Atlanta. When I was growing up, I grew up in DeKalb County, and Metro Atlanta was considered 5 counties. Might have DeKalb, Fulton, Clayton. I don't even think Henry County was considered in Metro Atlanta back then. Cobb County certainly wasn't, but there were a few others. But Metro Atlanta now is 15 or 16 counties, so it's a much bigger area, and we've built our product and our footprint in those areas. So there's a much greater market for this PPO and for our D-SNP than last year. And just if you want to make a note for 2019, nothing's been approved yet, of course, but we are looking at some significant expansion. I've been told we're expanding into 17 counties with our HMO product. So look forward to some more information on that. And the plan highlights, I'm not going to go line by line through every single detail, but I wanted to give you the highlights. The premium on the PPO is $57. So you can see where someone who might be on a Plan F, for 9 or 10 years, and the premium's kind of crept up there to where it's not as comfortable as it once was, can pay a $57 premium and get on the PPO plan. You can see the copay is $5 for physician, $35 for specialist, but I wanted to point out the 2 zeros. We do have a tier 6 benefit for prescriptions and 0 deductible. I'm going to show you a list of what those prescriptions are here in a minute, but many agents will tell you the hard part for clients to come up with is that deductible. Regardless of what plan you're on, some of our competitors have a $300 deductible, others have $500, and it's kind of all over the board. But it's not the copayment, even in the higher tiers, that's hard to come up with. It's that large deductible, and of course, we have no deductible for prescriptions. And just so as a few more highlights, of course, seniors travel. If they travel overseas, there's a $25,000 emergency benefit. Of course, there's no copayment for an oral exam or cleaning or an eye exam. But I want to point out, anyone who's ever heard me talk about our products before, we always want to point out the hearing aid benefit. No copayment for the exam, no copayment for the hearing aid, up to a maximum of $3,000. Another good prospecting idea, and an agent actually suggested this to me, and I went into an office with one of our agents in an audiologist's office, and it was a little awkward at first. They thought I was with provider services and was going to talk about their reimbursements and those things. And once we got past that, I asked them 2 questions. Do people come into your practice who need hearing aids that either can't afford them or just don't want to pay for them? And of course, the answer was yes. And I asked them, and I didn't know what the answer to this was going to be, but I took a risk and I said, if your patient had our plan, would it be profitable for you, the audiologist? And they said, of course it would. So I would suggest, if you have relationships with audiologists, I know there's many agents use provider referrals as a source of leads. I would highly suggest you do that. They're very good leads. But if you have an audiologist you have a relationship with, even if you don't, make a cold call, make a couple of calls, establish one relationship. And you can print off a brochure on Custom Point with your contact information on it. It's a good hearing aid benefit, Blue Cross branded, and that you can put your agency or your name and contact information on, and they can hand that to their patient. Say, here, call this agent, call Dave Burke. He's got a plan you can get on, but time's running out. We don't know if we're going to be able to have this plan, in a few months. Especially during AEP, if you have that relationship, you really have a sense of urgency. You hand them the brochure. They hand them the brochure and say, hey, you've only got till December to sign up for this. You need to get hold of Burke or whoever, you're the agent, and make sure you get on this plan so we can get your hearing aid ordered. And of course, you're going to see silver sneakers appear many times throughout this presentation. Every one of our plans has silver sneakers. Well, that's pretty much the PPO in a nutshell. Like I said, I didn't want to go through every single line or detail. One of the other things I wanted to discuss was DSNP, and I don't want to make this a DSNP seminar. I have a whole different webinar and CE class for that, but this is sort of a market within a market, and I've learned this along the way. I owned an agency for 10 years, and I never wrote a DSNP app, but I learned it, and I'm really impressed with those folks in this market. So, because when you're in the DSNP market, you've really got to be part of your community. You've got to be seen and do things in this community. And it's a great business. It's a 12-month-a-year business. I met an agent in Macon. This guy, someone referred him to me, and he's kind of the Babe Ruth of DSNP in Macon, Georgia. And I asked him how he got into DSNP, because he has this really nice office downtown, and he told me, he says, well, when I first got in the business, everybody he worked with, all the agents, pretty much just worked AEP, and they might have wrote some life insurance here and there during the year, but he wanted something he could do every day. He wanted to work every day of the year. So he learned DSNP, got involved in his community, held events, still holds events every day, and writes tons of DSNP business. So you've really got to have that heart of service and know how to, know the different parts of Medicare, who qualifies for what, how to get folks enrolled in Medicare, and also the low-income subsidy. So just as a nutshell, Medicare is a jointly funded program between the feds and the state, and it covers low-income and needy people, children, older folks, blind and disabled, and those other people who need are in need of income and federal assistance. The low-income subsidy is a federal program that covers prescription drugs. One thing that I learned earlier this year is you don't have to, if you don't qualify for Medicaid, you may qualify for low-income subsidy. And it's that kind of knowledge that can help you build your business. When you visit with a manager of a food pantry or any other place you might do a venue or an event, any other venue that you might do an event, you can get into these conversations. What do you do for folks that don't qualify for Medicaid? And many times they'll say, well, what do you mean? And then you can go into that low-income subsidy conversation. Well, here's what I can help them do. And of course, the more you service these people, in these communities, the better, the more well-known you'll get, and the more business you'll write. And you're servicing your community as part of your business, and it kind of snowballs on itself. So the knowledge of knowing how to get somebody involved in Medicare, and getting on the low-income subsidy is very important. So what are the benefits of the low-income subsidy? I researched this on the Social Security Administration website a while back, and this number may have changed in the last 6 months or so, but estimated savings when someone gets the extra help is $3,900 a year. I've talked to agents and other people within Anthem to say it's a lot higher than that, but $3,900 a year to someone in that income level is a lot. It might mean they don't have to, scrounge for their rent every month. It might mean they don't have to visit the food pantry every week, maybe every other week. And of course, it reduces their co-payments for their prescriptions. You can see here that it reduces generic co-payments to $3.30, and brand name to $8.25. And it allows them to purchase a 3-month supply for one co-payment. So if someone is on a generic prescription, they can get a whole year's worth for just over $10, or maybe just under $10. So it's this kind of knowledge can help you in your communities and build your business. I put this chart on here to show you how it can reduce the PPO premium, because when you're on low-income subsidy, it reduces your prescription drug costs, which includes premium. So when you're on the PPO, if you have 100%, if you have 100% LIS benefit, it's going to reduce your premium to $32.50. Remember, our whole premium is $57. And the reason it doesn't get reduced to zero is it only reduces the part of the premium that applies to prescriptions. So if you have someone that doesn't apply, that doesn't make it quite to Medicare levels, but gets 100% LIS, it's $32.50. And I wanted to show you this chart. The HMO, this is kind of an internal chart. I couldn't figure out how to get rid of that, so I just left it alone. But I just want you to really pay attention to the PPO numbers. This is the premium for the different levels of extra help for our 5-star PPO. Okay, so let's get into the product. Again, I'm not going to go into every detail. There's a few highlights I want to hit. Of course, there's 2 cleanings, 2 oral exams for dental. $200. It's actually, and there's a $1,000 comprehensive dental benefit for the year. That's actually at $250 a quarter. Stand by for more improvements on that in 2019 if you're taking notes. Again, nothing's been approved, but we're looking to improve that benefit for 2019. And then, of course, there's you get 1 exam with a $200 frame and lens benefit. Again, we have the hearing aid benefit on the DSNP as well. $3,000 hearing aid limit. No co-payment for the exam. No co-payment for the hearing aid. I also want to point out that the $60 per quarter over-the-counter benefit. I'm also told this might be improving as well for 2019, but right now it's a $60 per quarter benefit. And one of the things that one of the competitive advantages we have is that a DSNP customer can use their ID card as sort of an ATM card. So they can go to the drugstore, buy up, shop for everything they need that's covered under the over-the-counter benefit, and they can swipe it just like they're using an ATM card. And the balance will be deducted from the $60 every quarter. I want to emphasize that because that's a huge. We still have a catalog they can order from. They can still do it by mail order, and our catalog is very much improved since last year. It's got good, nice photos on it for folks that have trouble reading, and they can still order them by mail. But the convenience of being able to go to a drugstore, buy up what they need, and swipe that card is tremendous. So remember that if you're taking notes and you're talking to your DSNP clients, hey, I've got a really convenient benefit for you with Blue Cross Blue Shield. Whoops, hang on, I'm making y'all dizzy. All right, transportation benefits, 24 trips one way, maximum of 60 miles per trip. Podiatry benefit, this is also overlooked by agents. We have a 0 co-payment podiatry benefit for 6 visits a year. When I came back to Blue Cross Blue Shield and got this position a couple years ago, I really studied this benefit, DSNP benefit. And I found that on average, diabetic seniors go to the podiatrist an average of 3 times a year. Well, here we're giving them 6 visits a year to go to the podiatrist for anything from a manicure to circulation issues. Many folks go to podiatrists simply to avoid amputation, and here we're giving them 6 visits a year with no co-payment. The post-discharge meal benefit. What that is we the hospital, once they get discharged, we will deliver 2 meals a day for 10 days, so 20 meals altogether. There's some incredible statistics on nutrition and recovery, and when we want folks to get the proper nutrition when they get out of the hospital. And I guess the statistics I read were readmission. If you get the proper nutrition, the readmission rates are incredibly low. And this is another benefit we're going to improve for 19. From what I'm told, nothing's been approved yet. But because we really want it, we want people to get that nutrition, so that honestly to help the readmission rate, help reduce the readmission rate. Nobody wants to go to the hospital twice. So that's a benefit that we have this year and will improve for 19. And then we have a personal emergency response benefit. Anybody on a D-SNP plan can get this. All they have to do is call up. And this is that device where you see on television where they say I've fallen and I can't get up. And the technology has improved so much since this device was first started being sold into the public. They work off of cell towers now, so it's portable. You can still use a landline for those people that don't have any cellular capability or might live in a rural area. You can still use your telephone line, but it's just a much improved technology, and folks can use them as a lanyard, or there's a little watch unit that they can wear around their wrist. And again, it's anybody who has a D-SNP policy can get this. They just have to call up and say they want it. And of course, everything we have has silver sneakers. Live Health Online, these are a few of the ancillary benefits I want to talk about too. Live Health Online is a 24/7 telephonic benefit, but technology's come so far in the last few decades that now if your client, regardless of what plan they're on, the PPO or Medicare Advantage or D-SNP, they can use this benefit. If they have the video capability on their computer, their phone, their iPad, whatever tablet they're using, they can talk with a physician face to face. They can still use the phone. They don't have to do it by video, but this is a very convenient benefit that saves a heck of a lot of time. Many of us use the minute clinics and the urgent cares, and you go there, you spend an hour or so, you're sitting around with a bunch of sick people. Here's a convenient way just to make a phone call. Do I need to go in? And they can call your prescriptions in right there from your own home. Of course, if it's an emergency, they're going to tell you to call EMS, call 911, whatever the protocol might be. And I just wanted to show you before we got to the end some of the Tier 6 benefits. Remember, we have a zero copayment for Tier 6 on both plans, the 5-star LPPO and the D-SNP. And just wanted to show you some of the cholesterol drugs, diabetes medications, and high blood pressure medications that are covered with no copayment under Tier 6. This is I just wanted to show a little little blurb on the hearing aid benefit. This is my favorite benefit of all. I mean, I think if agents would, you can easily put together a little business plan and work with audiologists to generate leads. And there's a great piece out there that you can put your contact information on that you can hand out, or have establish a relationship with an audiologist and ask them to hand to their patients. Zero copayment for the exam. This is actually improved benefit for 18. It's a 3-year benefit now. We changed that in the middle of the year. It's a 3-year battery benefit and a 3-year warranty. And we're keeping this benefit for next year. And then here's our Silver Sneakers blurb. I just wanted to show some of the statistics about Silver Sneakers. But one of the things that's overlooked about Silver Sneakers is the social benefit. You have a lot of older people who use it just to do something with their friends or to make friends. I read this article a year ago about a lady who got a note in her mailbox from a 96-year-old woman who lived on her street that basically said, everyone she knows has passed away. Will you be my friend? It's a long story. And this lady went on to form a foundation to help lonely seniors. Well, here's if they had a Silver Sneakers benefit, they can even use the transportation benefit to get to a Silver Sneakers class, to make, not only to get the physical activity, but to make friends and have a group to hang out with every week or every day. But if you look at some of these statistics, 78% of the participants, said that was an important reason for them signing up for our plan. And then this one in the middle here, 64% said they would switch plans if we ever got rid of it, which is not going to happen. And then the 37% of Silver Sneakers participants never had a gym membership before. And remember, there are 3,000 locations all over the country that can be used, and you don't have to be tied to one gym. So if someone wants to go to a Pilates class at their church and then go to swim aerobics at the Y, they can do that. They're not tied to one specific place. So let's talk about Medicare supplements for a bit. You know, Georgia in particular is still a Medicare-heavy state. I read an article recently that nationally, 1 in every 7 people on Medicare have a Medicare Advantage plan, which means 6 out of 7 have a Medicare supplement plan. I also read that's going to change between now and 2021, where 1 in every 4 people will be on a Medicare Advantage plan. But right now, Medicare supplements are a huge part of our market. And of course, the Plan F and Plan G are going to be your more popular plans. For those of you who aren't familiar with Medicare supplements, Plan F, simply put, pays for everything that Medicare doesn't pay. Co-payments, deductibles, whatever it may be. Plan G, same plan as Plan F with one exception. It pays for everything except $183 Medicare Part B deductible. And the premium between F and G is substantially lower on G than F. So you're looking at a premium on a Plan F of around, and for our plan, it's around $220. In Plan G, we're down to $130, or sometimes less, depending on what discounts you qualify for. We do have some new plans coming out. We will be having a rate reduction, not necessarily new plans. The Plan F is Plan F and Plan G is Plan G. But we'll be having some rate reductions. You'll be hearing about that soon, something probably today or tomorrow, about rate reductions on Plan F and Plan G. So to that end, we have a bonus incentive for agents that we're running from now until AEP. So for July effective dates, August effective dates, and September effective dates, you can earn up to $225 per application. It's a tiered bonus, as you can see here. The first 4, you have to have 3 to get in the game. So if you have 3 or 4, we're going to pay you a $100 bonus per application. But you can see if you go from 4 to 5, it's a pretty big jump. If you write 4, that's a $400 bonus. But if you write 5, it goes to $750, because now we're paying $150 per app. And if you really want to bust it and write, 10 or more, we're going to pay $225 per application that's approved, has to be approved. And so, if you write 10 and really bust it, you're looking at a $2,200 bonus in addition to your commission. This is every month, every effective day. So right now we're running this bonus for July, and we'll run it again in August and in September. If you have any questions about this, give me a ring. I'll put the contact sheet back up there before we're over. But that pretty much concludes our product overview. Jeff, have you had any questions come up?
Yeah, we've got a couple things here. Dave, I wanted you to go back over and talk a little bit about, you mentioned earlier in the presentation about assessing a particular client you might be sitting down with that is on a Plan F. They've experienced a number of rate increases, and maybe it's not the Anthem Plan F that's getting ready to have a reduction in premium, but would like to find out what you would look at to decide whether they are a good candidate for the 5-star PPO, how you would do that.
Yeah, so when I first got into Medicare, it was 2013. Well, I wrote Medicare plans for a long time, but in 2013 we really got into it. So that's 5 years ago. And our with Anthem and Blue Cross, our average increase is 2.5%. So you add 2.5%. Someone's been on one for maybe 10 years, and you add 2.5% to that their premium might have gone from $200 to $300 or more. So just by even if it's a small increase, and they might be with a carrier that's had a significant increase, I can't mention names, but there are carriers out there that have had significant increases in year 2, 3, and 4 of the client's policy. So if you meet someone that's on Plan F, ask them what their premium is. Ask them what it was when they started, and if it's gotten a little uncomfortable for them, show them the PPO. They can change to the Medicare Advantage PPO right now. That's what I mean by that. So someone's, the increase might not have been significant, but over time it kind of creeps up there. And the only way for someone to get on so if someone's on Plan F, regardless of the carrier, and they want to change to another supplement, say Plan G or N, with a lower premium, they've got to go through underwriting. Well, if someone has health issues, their only choice really is to go to a Medicare Advantage plan. It's also a good strategy for AEP. But right now, like I said, if you market the PPO, the 5-star plan, you can sell it now, so you can easily build up a lead base for AEP. So does that answer your question, Jeff?
Yeah, I think that'll cover it for that particular agent. How about on the PPO? Can you talk about the network and how that's built out there in the state of Georgia, Dave? The major hospital systems that are included there, and any major providers in the metro area. Are there any deficiencies that you guys have seen, or are you addressing that? And in the case of an agent coming across a doctor that's maybe not listed, how would they go about correcting that? And to that, where do we check the doctors with you guys?
Yeah, there's a couple answers to that. But where you check the doctors, you can go on to, the broker portal or mProducer, which is our online tool for Medicare, or simply just go on to Blue Cross bcbsga.gov and click Find a Doc. As far as deficiencies, I will say there's two places that two facilities that we don't have, and that's Piedmont in Atlanta. They don't participate in Medicare at all, and they never have. They have an exclusive with another carrier, and it's not us. It has nothing to do with what happened on the commercial side with the mess you saw in the paper. They've never been part of our Medicare Advantage network. That doesn't on Medicare supplements, it doesn't matter. You can still use your Piedmont doc, but the other place is in Augusta, the University Hospital there. We're working like crazy to get them. I've heard rumors about 19, but it's just rumors. So those are the two places right now, or two facilities that just aren't in our Medicare Advantage network. Otherwise, we've got the entire Blue Cross Blue Shield network of providers at our fingertips. And if you do run into a provider that's not in our network and they're willing to be in our network, simply send me their contact information, name, address. Make sure you put the practice name, phone number, email address, and I will forward it. We have provider services people that I have great relationships with that will contact them, and it's not a fast process, but over a matter of 60, 90 days, we can get them into the plan.
Great. Let's talk a little bit about marketing, Dave. Can you go back over what's available inside of Custom Point for the agents to use? Since obviously you can't find a name any bigger than BCBS of Georgia or Anthem, what can we find available to the agents to use for marketing?
Yeah, it's really the question is, what can you not find? There are dozens and dozens of brochures, flyers, print ads, anything you can imagine that you could customize for yourself. For your agency or just for yourself. You can put your contact information, your website, and if you don't know how to get into Custom Point, again, my contact information is on the screen right now. Just give me an email or give me a call. I'll teach you how to get in there, and find what you need. The one I use the most is the hearing aid flyer, but there's a podiatry flyer. There's a dozen contact me flyers that you can use for mailers, or just however you want to use them. There are posters that you can use for your events, invitations that you can send out for your events, and anything you can imagine is on there. There's even some PowerPoint presentations that you can use if you're giving, presentations to customers at your events. I'm losing my train of thought, but yeah, so there's PowerPoint on there that you can use as well. So there's anything you can imagine, and it's all customizable.
Awesome. Let's talk a little bit about the MedSup again. You mentioned that F rates should go down in the next couple of days. We'll see a rate reduction there. But if people are a little hesitant to go to a GNN, can you address a little bit? I think what agents have sold typically in the past is a worry or fear of excess charges, which is one of the reasons why F was so popular. But can you address why maybe that's going to go away?
Yeah, and you hear that all the time about 2020 Plan F is going to go away. It's actually not going away. You just won't be able to write any new business. People that are on Plan F can keep their Plan F policy. So be careful when you use that term "going away," because those, your customers that are on Plan F can keep it. So I was looking I had a piece of paper on my desk. I might have given it to somebody about what the rates are going to be. Starting in July, our Plan F rate is going to be significantly lower. I wish I had it. And our Plan G rate it's basically going to be no increase. I think we went from 130 to 129. And I think depending on whether you're a smoker or non-smoker, our Plan F rate right now it's about 220, and I think it's going to be right around 200 or just a little less in the 190. So as soon as I can, I'll get that information to you, Jeff, and you can send it out to your agents.
Okay. Will we be able to get these slides from you today, Dave, to send out? Normally what we do is for everybody that's attended today, we'll put a little thank you letter together and send out all the information. So are you good with that today?
Are you talking about on the Plan Fs, on the new supplements?
Well, just the slides that we presented today so that they've got a reference to. Obviously, we're recording it, and that's there in the Messer library, but we also like to give something to the agents that did attend with us today. So just to let them know we will be including that, if that's okay with you.
Yeah, it's fine. In fact, I sent it to you late last night, but I added a slide, so I'm going to send it to you again when we're finished.
Okay, beautiful. Well, it looks like that's the questions we have for today, guys. As I mentioned, please take advantage if you're in the Atlanta metro area. Stop by and see Karen at our Atlanta office. Take advantage of the new agent trainings. If you've got any questions about Anthem and Blue Cross in Georgia, please reach out to us. We'll be happy to facilitate conversations with Dave and get you set up to where you feel like you can have a great, successful day in the field. And updates will be coming shortly for all the 19 plans. We're excited about everything. A lot of the carriers are excited. And again, the southeastern United States will be a highly contested area for competitive plans. So I'm sure Dave and Anthem are getting ready for that. And as soon as we have information, we'll share that with you. If you have any questions, please reach out to us here at Messer at 866-568-9649. And we'll see you next Wednesday with our next webinar. Dave, thank you so much to you and Anthem, and we look forward to working with you guys this fall. Thank you so much.
You're welcome. It's my pleasure.
All right. Take care, everybody, and have a great day out there.